Hello, everybody. My name is Jeff Browdy. I'm the Chief Executive Officer at PCI HIPAA. And today's webinar is protecting your practice during COVID. And we're going to focus on cybersecurity, HIPAA, and OSHA compliance. And I know that we're all going through some challenging times. And I just first and foremost want to thank you for joining. I know your time's valuable. And I know this is a topic that I'm super passionate about. We at PCI HIPAA, we were founded back in 2012, and we always like to say that HIPAA protects patients and OSHA protects workers, and we protect you. And that's really my objective for today. What I want to focus on over the next hour is first to start off with some of the HIPAA headlines, some of the things that we're reading and seeing. This is what we do and my team does every day, and some of the risk considerations that you should think about. We'll get into a little bit to the law of OSHA and HIPAA, but I really want to focus on the most common vulnerabilities that we see, and ransomware will be one of them. Some things you should consider around COVID. We're going to round it up with 20 tips to protect your practice. And then we have a way that you can take a risk assessment to kind of assess how you're doing and how your practice is doing. And you don't necessarily have to take any notes. I tend to go quickly. I'm going to try to slow down a little bit. I've had about 16 cups of coffee and 4 Diet Coke, so that's a little under my normal. But I'm gonna actually try to take my time. I do enjoy these. I'm super passionate, and it's packed with a lot of information because everyone is in a different position as far as understanding these topics. But don't worry. Again, I'll send you my email. We can send you the presentation, or it'll come by email, and we'll send that to you, so you don't have to worry about taking a lot of notes, because I probably tend to go pretty fast because of the time and what I want to cover. So let's talk about HIPAA. The Health Insurance Portability and Accountability Act, it was enacted by President Clinton back in 1996. And the objective was to reduce costs and simplify the administrative processes and burdens. And we always know when the government gets involved on this pre-inaugural evening, we know that they never simplify anything. They always make it tougher. It's tough to understand what to do. We talk to thousands and thousands of dental practices and medical practices, and we understand your frustration. But I think what we can all rally around is that HIPAA is really around improving the privacy and security of patient information. And we know that that is one of your most valuable assets, and you want to make sure that not only do you treat patients well, but that you also consider treating their information well, because you need to do that. It is enforced by the Department of Health and Human Services, the Office for Civil Rights. It is not an option. It is the law. And whenever you're considering, I don't just like to fly in and say, okay, you got to do all these things, which many people do consider of what do I need to do? How much time and effort should I be putting into HIPAA compliance or OSHA compliance or PCI compliance? And really, again, we're all different, and we all have a little bit different risk tolerance. So there is risks for non-compliance. I mean, like I said, it is the law. What you have to consider is, is the HIPAA police going to knock on my door? I'll tell you, probably not. That's not what they do. What they typically do is they will get a patient complaint, or they will, or it's kind of a self-reporting law where if you have a violation of over 500 records, it falls under the HIPAA notification rule, and you must report that to the Health and Human Services. I'm going to show you what that looks like. And then they can come back on the day of that data breach or loss or reportable offense, and they will ask you what safeguards did you have in place at that time. And that could lead to a fine. That could lead to financial and reputational risk if you haven't implemented any safeguards. So those are things that you have to consider. As what I'm trying to do in the presentation today is to really focus on the areas that I feel are material. that I feel where there are gaps within the industry and things that you can focus on and are tangible for you to take back to your practice. Now, I thought this was really interesting. So I don't always read the consumer reports. I probably should, but sometimes when I buy something. But it was interesting online. I read that they said protect yourself. So they're talking about your patients. Protect yourself from a medical data breach. Your most personal information is stored by hospitals and doctors and dentists and insurance companies is increasingly a target for hackers. So why are they warning your patients about your safeguards and what you're doing, and why are your records under attack? Well, I'm gonna walk you through that. And before I do, that headline is been increased and accelerated with COVID-19. Because with COVID, I always like to say, I don't like to say it, but I do say it, that bad people do bad things even during bad times. And these hard times on all of us, we have this thirst. I mean, I know every COVID headline, I'm trying to get information. Now I'm trying to get information about the vaccine. Months ago, I was getting information about when businesses were going to close and when they're going to open and what we needed to do and how should I wear my mask and what are the risks and all of that. From the beginning of back in early March, we were worried about this. And what happens is people they buy URLs. There's been an increase in malicious URLs that aren't even real, that grab your attention. They send phishing spam messages. There's been a huge increase. And they do that because they want to attack your data. And we're going to get into ransomware in a little bit, but I want to show you this. If I Google buy stolen medical records, which I did before, because I like to prepare. I am very prepared. So I Googled buy stolen medical records because I don't want you to have to watch me type it in. But if I just scroll down on Google, how much is a medical record worth on the black market? What do you think? Let's click on it. So here it says it's worth $250 per record. And this was as of November 19th. So that means that they can go in, they can attack your network, they could take your data, they want your data because you have a lot of information, and they can sell it for $250 a record. So those of you that have 1,000 records, how much is that worth? $250,000. Quick math check. If you have 2,000, that's a lot of money to a hacker. And what they do is they go on the dark web and they sell it on a site like this. Now, this is a site that's actually on our web, the ones that we go on, but there is a whole anonymous dark web that you can go on and shop. And this is kind of what it looks like. I mean, I can buy a Venmo account. I can buy a credit card dumps, which is the information that's on the magstripe reader of your credit card. I can pay with the credit card, and I can go on these, I get money transfers. I mean, this is a site where you're buying that kind of information. They have the dark web and they steal it and they put it on the site and they sell it. And that's how they monetize it. And what happens, as I mentioned before, is that if you experience a data breach, you have to report it to the Health and Human Services. So this is the Health and Human Services breach portal. And as I scroll down, this gets updated every single week. And there are healthcare providers, there are business associates, which we'll get into. It's happening in every state. And it's not just the big guys. So if we scroll down here, here's a dentist. Christina, sorry, I hope you're not on here, but if you are, we're going to talk about how you can better protect yourself. I mean, this dentist had 8,000 records. I can't even do that math in my head that quickly, but I think that's $2 million, something like that, worth of data that was stolen. But you even have medical plans and providers with less than 1,000, 800 records. 759 records. And it's every kind of hack. It's hacking attacks. It's unauthorized access into the server, into email. They want to monetize your most important information. And really, that's what HIPAA is about. That's what keeping data private and secure is about. And that's why you're required to implement safeguards to protect that information. And the fines are no longer immaterial. I mean, you could have a fine for just one HIPAA violation for $25,000 up to over $1 million in fines. And we've seen practices and organizations get fined for considerable amounts of money that have become really material. So you have to consider now how much risk and what safeguards you're putting in place to make sure that you're protecting the privacy and security of your patient information. That's what the law is about. There is the HIPAA security rule and there's the HIPAA privacy rule. And before I talk about law, I always want my my webinar attendees to read my disclaimer. So please read every word. Do not miss a word. This is very important. But just to get to the point, Jeff, that the HIPAA law is challenging and not everyone understands it. And I'm going to try to summarize it for you. We're going to focus first on the HIPAA security rule, and that's about keeping your data secure. There are 3 sets of safeguards that protect the patient information that you have. And it's not just the technical safeguards. So many of you I know feel like, well, my IT provider has this all covered for me and I really don't need to do anything and it's all safe. Well, not really the case. So administratively, there are some things that you need to do, which we'll get into. Technically, hopefully your IT provider is supporting that for you or you have somebody in-house doing that. And physically, you have to protect that information. So administratively, let's start with raise your hand if you have conducted an accurate and thorough risk assessment. Pause. Why am I pausing? I can't even see you. But I know, because I talk to you all the time, and so does my team, that many of you have not conducted a risk assessment. Why? Because you don't know what to do. You're not sure. What is a risk assessment? How far do you need to do? What do you need to do? Again, this is that risk tolerance. Do I have someone come in and do I pay thousands and thousands of dollars to understand what my risks are? Maybe in some cases that makes sense, depending on how many records you have and how much risk you have. But I will tell you that the first thing that an auditor will look at, maybe one of the first things, is that they're going to want to see that you've conducted that assessment. They want to see that you have started a culture of compliance in your practice and you've identified the areas that are vulnerable. That's the key. Where are your vulnerabilities? Are you addressing those vulnerabilities? So you have to have that risk assessment in place. A lot of this is defined in your policies and procedures. So many of you purchase a really pretty book from the American Dental Association or another association or a lawyer, and you put it on your shelf and it sits there and no one reviews it. Or you don't have them or you haven't updated them. I understand that. But I do really believe that policies and procedures are your roadmap to making sure that your practice is having that culture. It all starts at the top. And if you don't have policies and procedures and you're not explaining what a sanction policy is or an acceptable use policy of how to use your equipment or your internet or social media, and you're not explaining that and training your employees, because you have to do security and awareness training, then how do you expect them to keep your data private and secure? So it's important to have that risk assessment. It's important to have policies and procedures administratively. It's really critical to implement security and awareness training. These are all part of the administrative safeguards under HIPAA. They now require emergency and incident response management and documentation, as well as executing business associate agreements amongst your business associates. So again, administratively, there's some paperwork to have those agreements in place. There's paperwork to execute those business associate agreements. And then there's even some things to do to assign. How many of you have assigned yourself as the HIPAA officer, or have assigned somebody in the practice that kind of owns what you need to do? I know in my house, if we don't assign a task, it will not get done. if I'm not assigning someone to clean up after the dog, it piles up. And I think it's kind of the same thing in your practice. If you don't have an owner, it doesn't get done. But that is now required under the HIPAA security rule. So let's move on to the technical safeguards, because on the technical side, your IT provider probably handles a lot of these, but you want to make sure that they're covering it. It's a good process to go through. Maybe a follow-up to talk to your IT provider and see if they're doing these. So having proper log off procedures so no one can get access. I know password management's a pain in the pass, but you have to do it, and it's important because people can get into your system. And encryption is important. How many of you, we're going to talk about this, how many of you are using encryption for data backup? How many of you are using it for email? How many of you are on Gmail and Yahoo accounts and not using encryption? That's a vulnerability. Updating all your firewalls, antivirus. I know what happens. I'm working on my computer and all of a sudden a pop-up says it's time to update, and you hit click and close and you don't update. And though that leaves your system vulnerable. And there's things that you need to do to make sure that you're getting automatic backups and monitoring. It's your responsibility to monitor what your employees are doing on your devices and on your network. And does your IT provider send that to you? Can you say that you actually have a monitoring process of people that are in your network? That's all your responsibility. That falls under some of the technical safeguards. And then the physical safeguards, are really, I think some of the risks there are when you're safeguarding your laptops and mobile devices, that's great. But what about if you are destroying them? And what about if you're getting rid of them? Are they just sitting around? Are they encrypted? Can someone get use of them? Oftentimes there's old devices that have unencrypted information on them. And physically, that's not a safeguard. That's not a proper safeguard. So you want to have policies and procedures around how you dispose of protected health information, and really understanding who's using each device. That's really critical, that you understand what they're doing on it, so you're monitoring it, but also who has access to that, and you have policies and procedures. And then under the HIPAA privacy rule, we have a whole webinar just on privacy, and we're going to talk a little bit about what the main things that you need to consider around the HIPAA privacy rule. So that was a little bit of the law. Now I'm going to get into the meat of the webinar and really talk about vulnerabilities that we see. And these are things that I hope that you pick one or two and you can walk away and be more secure than you were tomorrow than you are today. That's really my objective here, for you to take one or two, maybe three things back to your practice to make it to really consider, so that you're safer. So one vulnerability that we see, so PCI HIPAA, that's the name of our company. So PCI is in our name. And we really started the business under PCI, payment card industry compliance. And so why is that part of this, and why is that important? Well, first, PCI, the payment card industry, is made up of Visa, MasterCard, American Express, and Discover. It's not governed by the government. It's governed by the private companies, the associations of the credit card bureaus. And when there were a lot of data breaches that were happening, Congress put a lot of pressure on the industry to come up with laws to keep the credit card processing environment secure. And for any business, credit card information is personal health information, and it's personal identifiable information. And that information that's on that card, if you have a violation under PCI, under the payment card industry, you also have a HIPAA violation, because you have to keep that data secure. Now, as a medical provider or a dentist, you all accept credit cards. And if you accept credit cards over the internet, and that could be a terminal that's plugged into the internet, or that could be your practice management software that is also going through the internet. And if you are transacting over the internet, you must scan that IP address, and it has to be done by a qualified scanning vendor. That is a requirement under the PCI rules. In order to get your PCI certificate, you have to scan your IP address every quarter. And you also have to complete a self-assessment questionnaire once a year. If you do those things, you get a PCI certificate, you give that to your credit card processor, and you make sure that you're not paying non-PCI fees, non-compliance fees. Many of your processors, if you look at your bill, you will be charged a non-PCI fee if you don't have your PCI certificate. So you can, maybe this webinar right there will save you some money. I hope it does. Look at your bill, make sure you're not paying PCI, non-PCI fees, and make sure that you're scanning and doing your self-assessment questionnaire. The other risk around accepting credit cards is, now many of you have, we call it dipping the chip. So instead of swiping the card, that chip in the upper left corner, every single patient has that chip. So when they come into your practice, if your credit card terminal does not have the capability of accepting that chip, or your reader through your practice management software, and you are still swiping cards, you are at risk. And where you're at risk is if that patient who is in your practice, who you just provided services for, swipes the card instead of dips it in using the chip, and they charge that transaction back. If they go back to their credit card provider and they say, hey, I never had these services, or that these services were not provided to my satisfaction, you will automatically lose the chargeback if you swipe the card instead of dipping the chip. Because back in 2015, I can't believe it's been over 5 years now, but back in 2015, they made that a requirement. And we call that friendly fraud, and we're seeing that more and more. So make sure that anyone inside your practice can do that, that you can dip the chip. Now, scanning is important too, because those quarterly scans that need to be provided by a qualified scanning vendor, they will tell you if your Windows is out of date, and there's a lot of vulnerabilities with outdated Windows, by the way, and hackers know that. It's a way in. Also, your IP address, if you're not getting those scans, that will identify if you have vulnerabilities in your IP address. It'll tell you about Windows, tell you about software vulnerabilities. It'll tell you if you have open ports. So scanning that IP address is critical, not only to get your certificate, but to really, really protect your practice. So I think we may need to update our disaster recovery plan. This one suggests we all run around in circles shouting, what do we do? What do we do? And I put this in because I know no one wants to talk about disasters and what to do during a disaster. We don't have time for that. We don't like to think about bad things. However, I know what we all went through with COVID. Some of us couldn't work. Some of us had to leave our offices quickly. I live in Southern California. We had to evacuate because of the fires, and many of our practices had to evacuate. No, I don't need the violin. I'm just identifying some of the issues. Hurricanes on the East Coast. So the disasters, unfortunately, are happening more frequently, and you need to consider what to do. Now, under the HIPAA security rule, you need to have contingency planning, and you need policies and procedures in place that defines how you would respond during an emergency, a fire, a disaster. And it really consists of 3 different plans. One is a data backup plan. Another is a disaster recovery plan. And the third is an emergency mode operations plan. So how are you backing up your data? Let's talk about that. And I have a lot of slides here, but there are 2 slides, 2 or 3, that are probably ones that I really want you to think about. And I really believe that these will protect your practice if you really think about these considerations. So data backup and restoring your data are critical to surviving an attack or surviving in a disaster. So some of you haven't really had this discussion deeply enough with your IT provider. And if I asked you, how are you backing up your data? You may not even know. You may not know how often you're doing it. You may not know who's doing it. You may not know who's responsible for it. You may think your IT provider is doing it, but you've never asked them if they can back it up or if they can restore it. So think about that. Have you ever tried to restore your data or even understand how you would restore your data if, for example, you couldn't get into your practice, you couldn't get access to your network, and you had to go buy a laptop and get on the phone with your IT provider and restore your data so that you can try to conduct some sort of business? How would you do that? How long would it take? Who would do it? How many backups are you backing up? We recommend and we back up over 10 consecutive days of data backup, because if you only have one backup set and something happens to your network, like a ransomware attack, and they back that up over your clean set, and now you only have a backup set with a ransomware attack, then it doesn't do you any good if you try to restore it. So you need multiple sets of backup. It needs to be off-site. It needs to be encrypted. And you have to know how to restore it. Those are all really key. And we're even telling and advising clients now that you need multiple backup providers, not just one. And I'll share with you a story, and what we're seeing more and more is, and so you can get an idea of why. But just one more second here, I'm going to pause just a little bit on this data backup. Know how to back it up, know how to restore it, make sure it's encrypted, make sure it's off-site. If you're doing that, you're way ahead of the game. Way, way, way ahead of the game if you really understand that. Okay, email encryption. How many of you are using Gmail and Yahoo and AOL? Raise your hand. Why do I have people raise their hands? I can't see you, but I can feel you. I know how many hands. I guarantee I can come within, well, there's a lot of people on tonight's webinar, but I guarantee that some of you are using a free service to do email, and nothing is free. My dad taught me that. And because they use that data in the email to advertise to whoever you're sending it to. They'll see what's in there. They use their algorithms. They use it to advertise. They get more information on you. And some of them, I think Gmail has pretty good encryption. Some of you are probably using it and don't even know that you can encrypt your email. I would definitely suggest getting your own email exchange server, because if you have your own email exchange server and it's set up correctly, you will scan the emails going out, which is good, and you'll scan the emails coming in and block out some of those ransom and phishing emails, and they're always updating their algorithms to help protect you. But if you're not doing that, you're at risk. So email is definitely a risk, and employees don't fully understand the risk. We're going to go a lot deeper into ransomware, and I'll show you some examples. But email is definitely a vulnerability that you got to get your arms around. I mentioned that I do a whole webinar on the HIPAA privacy rule on how to keep data private. According to your HIPAA release form, I can't share anything with you. That's not a bad thing. But I put this slide in about I would say maybe a couple years ago, and practices are getting fined left and right. One of the biggest fines right now coming out of the Office for Civil Rights is not providing patients their own information. So when patients request information, it's their information. And practitioners that are not getting the patient information to them timely are actually getting fined. So I thought this was kind of a joke because people are really not aware of the law, but it's actually a lot of that stuff's happening now, and they're actually not giving information out to patients, but it's their information. And look at how much information you have: names, social security numbers, URLs, fax numbers, birth dates, mother's maiden name, email addresses, everything a hacker needs to monetize your data in order to make money, in order to create identity theft, in order to sell it online. You have all this. And this is called individually identifiable health information. And any of this qualifies, and this is what you need to keep private. And you also have to keep this extremely, extremely secure. So under the privacy rule, you're a covered entity, and you must obtain your patient's written authorization to disclose protected health information. That is the general rule. It's their information. You have to get authorization in order to share it. It starts to get confusing because if a life insurer calls up or an employer calls up or a school for a child and they request it, it kind of makes sense that and there's probably a ton of other instances, but you can't just share it. It starts to get really tricky with family, but I'm not going to get into all those details, but you can't just know that if someone is asking for patient information, you cannot share it as a general rule. And the exceptions that I want to identify are a couple. One, if you're working with another doctor to treat the patient doesn't need to give you authorization to do that. The HIPAA rules do not want to interfere with treatment or payment. So for you to get paid, the patient doesn't have to authorize their information to share with somebody for you to get paid. And they don't also have to authorize for you to treat them. So you're allowed to take their information, share their procedure with another doctor, share their information with, your bank or your payment provider to get paid. And then there's also some healthcare operations. If you were getting audited for compliance or insurance processing, HIPAA is not going to interfere in your normal course of business. Now, where I hear things, a couple areas where we always get questions, it kind of falls under the minimum necessary rule, and here's the little logo of too much information and don't share too much information. A lot of this is just around being practical. So we get a lot of questions around, can I leave a message for a patient, or can I use a sign-in sheet? And the answer is absolutely. You could leave a message for a patient about their upcoming appointment, and you can have a sign-in sheet when we're allowed to use the lobby again to know who is in your lobby, but you have to use the minimum necessary information of theirs in order to execute whatever you want to do. And it's kind of practical thinking. You have all their information, you have their social and their birth date and their procedure, but do you have to use that information to confirm an appointment? Do you have to use that information, all of that information, to know who's in your lobby? No, you don't. So you want to use the minimum necessary information. There's actually a rule on that to execute the work that you need to do on behalf of your patients. There's also a lot of laws with regards to subpoenas and court orders and what you're allowed to do. And I would just, you kind of lean on when that starts to happen. You don't necessarily have to get their approval, but if something like that were to happen, I think practically you would discuss those things with your patient. But here's another list of exceptions. Okay, let's talk about business associates. I got a couple questions. Someone gave me a high five, and thank you for the thumbs up. I appreciate that. You don't all have to do that. Yeah. So there was a question around that, can you share with other practitioners without their permission, asking other hygienists about payment, treatment, and conditions and x-rays. If you are working with another practitioner and that practitioner and you are both treating the patient collectively, you do not need the patient's authorization in order to get additional information. Okay. Business associates. So let's go back to that. So you are considered a covered entity. And if you share information, if you share protected health information with a business associate, that you need to have an agreement in writing about the terms and conditions of you sharing that information. So the obvious question, Jeff, is who is a business associate? So I've defined that here for you, that a business associate is someone or entity that performs certain functions or activities, and it's involving your patient information for them to do their job. That's the key. It's sharing information for them to do their job for you, not an employee, but someone who you're sharing that. So think about that. Who are you sharing information with? That's sensitive in order for them to do their job. That's a business associate. That's where you need a business associate agreement. And here's the famous cheat sheet that everyone loves. But just think about it in practical terms. If you have a claims or processing or administrator that comes in and let's say it's a third party and they're doing work for you and they're not one of your employees, you have to get a business associate agreement with them. If you are using a CPA firm or an accounting firm and you're giving them access to your QuickBooks with all your patient information in it, they have to protect that. If that gets into the wrong hands, what's going to happen? You will be exposed legally if that happens. Your IT provider, they have access to all your networks and all your information, or an email marketer, they have access. All of these, anyone who has access that's not your employee, that you're sharing protected health information with, your patient information, you need to execute a business associate agreement with. Now, back to the exceptions. Not with other doctors. Not with other doctors. They're covered under HIPAA. You do not need an agreement with them, or your labs. You do not need a business associate agreement with you. You can conduct business and share information with your lab. Medicare, Medicaid, for insurance purposes, you don't. Your payment processor or bank to get paid, you don't. Janitors, electricians, and landlords, we always get questions here because they have access, if they're in your practice, to those records. But think about it. You're not sharing that information with them for them to do their jobs. So your janitor who comes in to clean your practice, they shouldn't be accessing your protected health information. They need to clean your facility. Now, you need to lock it up and you need to train your employees to lock it up, but you don't need business associate agreements with them. Or you don't need them with the UPS or FedEx or that either. And then even with your employees, you're not required to execute business associate agreements with them. They are part of your entity. You are required, as we mentioned, to provide that security and awareness training, but you don't need to have a business associate agreement. And the most important part of the business associate agreement is the indemnification clause. That's what you want to make sure that you have in your agreement with your business associate, because again, what an indemnification clause does is it indemnifies you. It protects you financially if your business associate were to have an attack, if your business associate had a breach with your data. They need to indemnify you, and you want to make sure that that clause is in your agreement. Make sense? Yeah? Yes? Yep? Awesome. I think I heard a lot of yeses. I felt it. So let's go to the next vulnerability, ransomware. So I think I'm so close to this ransomware because I see it every single day. I read about it every day. It happens to our clients every day. I'm always curious on how other people, are aware of it. So this might be something that you're completely aware of, or it might be something that you're not. In either case, it's probably a good time to review it. But if you're not aware of it, believe it or not, it's malicious software that encrypts your files. It locks down your screen, and the perpetrator actually calls for a ransom request. And it's typically paid through Bitcoin, because Bitcoin is an anonymous currency. They create this huge sense of urgency, and it is usually through an email. They call that a phishing attack. And what happens is you come into your office and you see this. Your computer has been encrypted. You can't get in. And it's military grade encryption. and there's this, the price is going to double. Here, I'm going to give you a decryption key. All you need to do is send me X amount of Bitcoin. And we actually have a Bitcoin account because this happens, and we need to help. And again, if you can't restore your data before the ransomware attack, before this happened to your computer, that's why that backup slide is so important. Then you're almost stuck having to pay the ransom, and that's scary. I know it is. I've been through this, and unfortunately, it happens. Hopefully, this hasn't happened to many of you. This is actually a great quiz to walk your employees through, and it's phishing quiz with google.com, and it'll actually go through, and you'll be able to identify phishing emails, and it'll ask you about them, and you'll be able to recognize them and think about what they are so that you don't fall victim to them. Now, this is one that my wife received from Costco because she loves Costco and I hate Costco. I just think those big things of mayonnaise and barbecue sauce are just disgusting, but she likes to bring them home. And they have good prices if you have Costco. It's like a Sam's Club for those of you in that area. But this is an email from them, and it says, unfortunately, the delivery of your order was canceled. Oh no, I'm going to click on that. I don't remember ordering something. And this starts to penetrate ransom and malicious software in your system. If your employee were to get this, or if you were to get this, it would happen. Now, if you look closer, which I didn't point you to, but look at the top, and it says Costco shipping agent, manager at CBC building. That does not look like a Costco email address. So this is what the phishing email does. You click on that, like whenever you see your email and it only says it doesn't say the actual address. If you click on that at the top, you will see the actual address and you'll see where it comes from. Now, this is one, again, same kind of thing at the top. It doesn't look like it's from PayPal from the sender, but it sure looks like it's from PayPal from the content. I mean, this is their logo. We need your help. My account's been suspended. This error was detected. Click, update, information. This is a classic phishing email. And it doesn't look like it. And if you're just not aware of this stuff and your employees aren't aware of it, it could lead to disaster. And so these are just a couple examples, but phishing emails and ransomware are things that happen and we see every single day. Now, remember I discussed earlier in the presentation on why you should consider multiple backup vendors. Well, the reason being is we're seeing more and more of this. So typically, ransomware was a strategy that went from the perpetrator to the practice directly. And they would send out massive amounts of emails, and they're hoping that someone clicks on it and creates malware through the system. Well, this is an example of an IT provider that provided some online services to dentist offices, and their software was hacked. And all of their clients got ransomware all at once. And so you can imagine if you're part of that group and you're trying to call the IT provider and they're just getting calls and they're getting bombarded, you can't get your data back because they're the ones that would be responsible for getting your data back. So if you're working with an IT provider that specializes in a certain type of dental office or even a medical facility, it's really hard for them to respond to this. So be aware of it. We actually had a couple clients that were part of this. They were backing up their data with us also. And it's great to have another source in case something like this were happen. This will save your practice. This will save you time and money. This will save you so much aggravation if you really, really understand what's going on with your data inside your practice. So tech support says the problem is located somewhere between the keyboard and my chair. That's just not being aware of what to do, or your employees not being aware of what to do. And even your family members, Jeff, And I feel responsible for this, but I put this slide together because in the last 30 days, this has happened to my family. And I just want to share it with you so it doesn't happen to yours. I call it the family hack slide. There's my little family tree with the heart in the middle because I love my in-laws and I love my daughter and I love my dad. So my in-laws called me up and they told me that their bank got hacked. And I was honestly, I was just shocked. They had a $10,000 withdrawal from their bank. And we still don't know what happened. Luckily, the bank caught it. And we believe that someone might have gotten into their router from home because a lot of people are working from home now, and the hackers know that the routers and firewalls passwords aren't being updated, and they're able to get in, and then they can see your keystrokes and possibly even get into your online banking. But we didn't know that for sure. I had someone come in and go in and look into their computer, and we didn't find anything. But one thing that was extremely interesting in this case is, so they caught that the money went out, then they opened up a new account, and in the new account, within 1 day, they had 2 really small deposits of a penny. And whenever that happens, whenever you see a small deposit, that means someone has access to your account and they're checking to see if they can get access. So even on the new account, it happened. So we still don't know exactly what happened. My dad got a call. He still works. He works remotely. He does insurance claim processing for a medical practice. And he got a call from their IT provider who identified his name. He knew the IT provider's name. And the IT provider walked him through a series of work that he needed to do to upgrade his computer from the practice, from working from home. Well, it wasn't the IT provider. It was the IT imposter. And my dad, he was vulnerable and he gave him a lot of information that he shouldn't have. And that was just someone who connected the dots between my dad and their IT provider. There's a lot of different ways to do it. The same connecting of the dots happened to my daughter. So she got a new job, just graduated from college. I don't know how she got a job. No one's getting jobs now, but she did. I'm not bragging. I'm just saying I'm happy for her. But she got a call and she just happened to call me and she said, I'm so frustrated that this is a Saturday and my boss, which is her new boss, the CEO of the company, he asked me to go buy 12 Apple iTunes gift cards, $100 cards, because he needs to give them to clients that he's going to go see any minute. He doesn't have any time and I have to go do it. And I can't believe he's asking me to do it. And I told her, I said, before you do it, you got to call him. That does not sound like him. And it sounds like you might have been phished. And sure enough, she called him and they connected the dots online. They can go on LinkedIn and connect you with your CFO. They can connect you with your office manager and they can start making requests. They've made requests for wire transfers. They've made, never, ever, ever wire money to anybody unless you talk to someone on the phone. And then it's even then you have to even have a code because you don't want to fall into my dad's trap. You want to have a code to actually communicate a wire transfer, because in this case, we see it all the time, Apple gift cards or wire transfers, and they're connecting relationships and they're coming after us. So this all happened within 30 days. So just please be aware of it. This is also very dangerous. This is the Kentucky Fried Chicken donut and chicken sandwich, and it looks amazing. But I wouldn't recommend having this more than, I know during COVID, maybe we can go twice a month. No, that's too much. Once a month. But it is dangerous. It looks, I saw this and I was like, wow, that's as dangerous as ransomware if I have too many of them. So let me ask you another question. What would you do? What would you do if you had one of these breaches happen to you? Are you prepared? Are you really prepared for it? If you had a ransomware attack, if you had If you couldn't get in your practice, if you had an employee steal information, what would you do? That's a data breach under the HIPAA breach notification rule. Do you understand what you need to do? Because if you don't understand what the rules are, then you even accelerate what the penalties are because you're not following the rules. And the rules are all to protect your patients. And so you have to do a forensic investigation. You have to segment your data. You have to post it on a website. You have to, if they're going to call you, you have to be able to answer it. It involves coordination from a lot of different parties, and you need to make sure that you get help doing that. And it can be costly and it can be timely. And this was just one example of what this was one of our clients. And unfortunately, she didn't have her data backup in place. All the things that I described, unfortunately, this happened. Not everyone is on top of this stuff. I'm not even assuming that all of you are, because I know it's just hard to stay on top of it and you don't even know what to do. But in this case, unfortunately, she didn't have her backup and she had a ransomware attack, and we had to go in and we had to pay a little bit of the ransom and get some of the data, and then we had to pay more of a ransom, and then we had to bring forensics in, and then we had to do legal work on determining whether she had a HIPAA violation. And the bill came close to $200,000 when all was said and done. We got her practice up and going again. We got access to her data, and she was very grateful. But the one thing, and this is the slide number 2 I was telling you that's really super, super important, is that all of you have malpractice insurance, or all of your doctors do if you're office managers. You all have malpractice insurance. I know that you do, but not all of you have cyber insurance, or not all of you even know what's in your cyber insurance policy and what's excluded and what's not excluded. Because I'll tell you, you're going to want ransoms to be paid if you have to pay them. You're going to want HIPAA fines to be paid. Well, you're going to want loss of profits potentially. Patient notifications. If you get a HIPAA violation, you have to notify your patients. The point here is you have to have cyber. You have to make sure that this is your backstop. No matter what safeguards I tell you about today, you're not going to be able to implement them all, and they are really smart, and you can't stay on top of it all the time. So you have to have a financial backstop. Your financial backstop is a cyber insurance policy, one that covers these things. You don't need millions and millions of dollars, but you need a policy, and you need an incident response team so that you can continue managing your practice and have a team to help you get back up and running quickly, so that you don't lose your practice and everything you worked for. This is really important. Make sure you check if you have it. Make sure you check that it's a standalone good policy that doesn't exclude everything. And again, there's a lot of misconceptions that my IT firm handles everything that I talked about, or my practice management software is compliant, so I'm compliant, or my general liability policy will protect me, or I have so much empathy for all of you office managers that are on this call. You can't do everything. You need the help. And in this environment, make sure that you get it, and make sure that you talk to your owner, and you talk to your dentist or medical provider, and make sure that you get it. Even more empathy around COVID-19. I mean, I know what you all went through, and we did a survey, and these were like some of the big areas of a concern. This was done way back in March, and things change all the time. But the point that I want to make about this is that OSHA, which is occupational safety, is there's a lot of enforcement that's happening because employees are complaining, and even patients are complaining about safety under COVID. So let's hope the vaccine gets out. Let's hope this goes away. But in the meantime, there's headlines around not having the right documentation. And you need to have a written, comprehensive respiratory protection plan. Because the thing is, I know all this written stuff just sounds like just work. But the fact of the matter is, if someone comes in and asks you, what have you done? You have to have something in writing to at least show them. They're not just going to take your word for it. So it's not just having the PP&E, but it's having the written plan. It's showing that your employees are trained. It's showing the acknowledgments that you've trained them. It's all that proof that you need to do. and it has to be in writing. You need a respiratory protection plan. Also, for under OSHA, just as a reminder, you need an exposure control plan, hazardous communications, bloodborne pathogens. You want to make sure you have your safety data sheets in place, and you actually want to make sure that I know you all have a process of what you're doing for COVID, but if you ever got asked, you need to be able to document what that is, and I think that's really important. These are my favorite logos. I really like for COVID. I really like the Starbucks woman with the mask. I go to Starbucks, and the social distancing with the McDonald's arches. I only have 5 minutes, so I told you I just go too. Now this time I went too slow. I don't know enough, but here's quickly 20 tips. A review. Update your policies and procedures. Make sure you have them. Make sure employees read them. Document what you're going to do during emergency. Make sure that you know what you're going to do, especially around data backup. Those business associate agreements, you want an indemnification clause. Make sure you execute those. You want to make sure you document your progress in case you ever get audited. Documentation is critical during this. Don't share patient information without their authorization. There are exceptions. Take your employees through this phishing quiz so they can see what phishing emails are like, and you can share that with them. Never wire money without that verbal and even a code. I mentioned that, but this is key because I saw someone lose $100,000 because they got scammed on an email. Don't share patient photos on websites or social media without consent. Patient consent, patient consent, patient consent, even for testimonials. Beware of all your employees, especially new ones, and what they're doing around your protected health information. Make a bigger deal about passwords. Everyone knows that the keyboard or Jeff123 or Practice123 are always being used. On your mobile device, there's ways to screen lock and do pin locking. And if you lose it, you can erase it and make sure that it's set up that way, because if you have patient information on your phone, that's a data breach. Update all your firewalls and antivirus. Work with your IT provider, make sure they're doing that. On the emergency side, if you go to www.doonething.com, this is a great site. It actually walks you through doing one thing a month, and you're better off a year from now than you are today. Backup, multiple sets, 256-bit encryption, even consider multiple providers. Can't emphasize that enough. Wi-Fi is very, very, very vulnerable. Use a virtual private network. If you Google crack, you'll see how vulnerable public Wi-Fi is, like in hotel, if we ever get back to a hotel. Laptops, don't store any patient information on your laptop, or make sure it's encrypted. It's the #1 device that's stolen or lost. Email, get an Exchange server. Stop using the free email services. They're not great. Get your cyber insurance or review that coverage. That is your backstop. Do those scans and get your PCI certification and reduce your PCI fees. Again, my goal is for you to take one or two things away. And if you're going to take one thing away, absolutely one thing, well, aside from the cyber insurance and aside from the data backup, the next thing is doing a risk assessment. Because if you ever get a complaint, if you ever get audited, they're going to ask you for that risk assessment. You have to have it on file. And here's where you go get it. This is your risk assessment. We've set up a link for you. All you need to go to is our website, PCI HIPAA. It's 1P and 2A's.com. And it's /Viva for being on the Viva Learning webinar today. So PCI HIPAA /Viva. You can go in and you can just you can take the risk assessment, and we'll get it to you. We'll call you. We'll walk you through it, and you'll have it on file. And if you have any questions on any of it, you could email me at jeff@pcihipaa.com. I really appreciate you attending today, by the way. As I hope you know, I'm very passionate about this, and I'm very passionate about helping practices. And this risk assessment is on us. So just go there and take it and see how you score. You'll get a score. You can go to your doctor and tell you how you scored in the practice. and it'll talk about a lot of the vulnerabilities we talked about, so you can see what your score is and and how you're doing. So we're right up on the hour. I know I was probably a little fast. I apologize at the end, but I wanted to just get through it. And again, if you have any additional questions, I'm not going to probably be able to get to all of them right now, but you can just email me at jeff@pcihipaa.com. I really hope that you enjoyed this, and I appreciate you being here, and have a magical evening.